Did you know that when most people stop taking Ozempic or Wegovy, they regain almost all their weight back, sometimes even more weight than they had before? And here's the truth nobody's talking about. These drugs were never designed to fix the root cause of obesity or insulin resistance. Now, they work by slowing down your digestion and suppressing appetite, but that actually comes at a cost. And today, I'll explain what these medications actually do inside your body, why the side effects are more serious than most people realize, and how you can protect yourself or a loved one if you're using it. Hi, I'm David Baker for the Diabetes Revolution, and we make these videos because almost everything you've been taught about diabetes is wrong. A quick note before we dive in, I've also put together a free guide called The 6 Steps to Reversing Diabetes Naturally. Now, it's going to expand on the strategies you'll learn here today, but we'll get in that in a minute. So, we're going to get started. So, what Ozempic actually does inside the body. So, what does it do? Ozempic and Wegovy are both brand names for a drug called semaglutide. Now, this is a part of a class known as GLP-1 reception agonists. They were originally designed for people with type 2 diabetes, but today they're being prescribed off label to millions of people by purely weight loss, just to help them with that. But here's how they work. They mimic a hormone in your gut naturally. Now, this releases when you eat um, glucagon like peptide 1 or GLP-1. Now, that hormone signals your brain that you're full and slows down how quickly the food leaves your stomach. In short, it makes you feel less hungry and keeps food sitting in your stomach longer. Now, that sounds simple, but it's not without consequences. So, when you artificially manipulate your digestion and your appetite, you're not fixing the metabolism, you're forcing it. And when the medication stops, your body rebounds hard. So, clinical studies show that within a year of stopping semaglutide, people regain 2/3 of the weight they lost, and many end up heavier than when they started. That's why these drugs are marketed as lifetime medications. Now, they only work while you're on them. And when you stop, your physiology fights back to its old baseline. So, this is exactly why true reversal must target the root cause. And that's insulin resistance, nutrient balance, lifestyle rhythm, and it's not just appetite suppression. Now, before we go further, I want to be clear about something. This is very important. Everything I'm sharing with you today comes from peer reviewed medical research, not opinions, not headlines, not hype. I've linked all the studies and the sources down below so you can read for them for yourself. And please always do your own research. That includes what your doctor tells you, what I tell you, what you hear on the news or online, because the goal isn't to follow anyone blindly. It's to inform yourself to make the best decision for your own health. So we're going to get into the hidden risks and what you're not being told. So here's what most people, and honestly, most prescribers don't even realize that the same mechanism that makes Ozempic works, slowing down your stomach, it can also cause some of the most dangerous complications we see. So the food sits in your stomach too long, and this causes gastroparesis or stomach paralysis. And that delayed gastric emptying can lead to nausea, vomiting, constipation, and even more severe cases, complete bowel obstruction. Now, I've personally cared for people in the hospital who came in with exactly that. They have intestinal blockages, severe abdominal pain, and most of them that I've seen recently have had this medication going on in the background. And now I'm going to tell you a story that really weighs heavy on me. A family friend of mine that went for a simple elective procedure while taking Ozempic. Now, her stomach hadn't completely emptied, even though they followed all the pre-surgery instruction. During anesthesia, that she aspirated food into her lungs and she developed severe complications that end up putting her on ECMO therapy, and then she passed away just a few days later. It was totally unexpected, completely preventable, and that's why anesthesiologists, they're now warning patients to stop these drugs at least a week before surgery because of how dramatic the delayed gastric emptying is. So instead of stopping um, intake of food like the night before, they always tell you the night before, stop eating at midnight. Don't eat anything past that before surgery. They're now telling them 7 days to stop before. That's how much it's delayed because of the risk for aspirations. And and but the bigger issue is with this is the conversations aren't really happening. Patients are rarely warned about these risks before the injections. Hair loss, fatigue, gastrointestinal pain, these are some of the most common complaints I hear from colleagues, especially among the women using these drugs. So before any medication is prescribed, informed consent should be included. And this is all the known risk and unknown. And that's what true care looks like because once you understand all the trade offs, you can make a real informed decision, not one based on marketing promises or desperation. And and there's even deeper dangers, like we got vision, cancer, and long-term unknowns that we're going to get into. So beyond the short-term side effects, new research is revealing risks that reach far deeper, last much longer. So we're going to start with vision. So this comes from studies out of Harvard and Denmark that found that people taking semaglutide, the active ingredient in Ozempic and Wegovy, they faced a significantly way higher development of a rare condition called non-arteritic anterior ischemic optic neuropathy. Now that's a mouthful, but basically that's when the blood flow from the optic nerve in your eye is cut off, leading to sudden and often permanent vision loss. Now there's no treatment for it, and it's happening in otherwise healthy adults who were using these drugs for weight loss. And then there's the cancer risk. So the drug's own package insert carries what's called a black box warning, the most serious warning the FDA issues. So I'm going to link that in the down below. In animal studies, semaglutide causes thyroid tumors, and while research hasn't proven it in the humans yet, the early data is kind of unsettling. So in a large study, they had an incidence of thyroid cancer that was double in the GLP-1 group compared to the placebo group. And then there's also signals of pancreatic complications and even possible interference with cancer treatments, including lower survival rates in women undergoing chemotherapy for breast cancer. So the medications interfere with how well the chemotherapy is working. So when a medication affects the hormones, metabolism, digestion at this level, the long-term ripple effects, it can touch every system of the body. And that's the point. We don't know what decades of use will do. These drugs are now being prescribed as lifelong therapies. But the long-term safety studies, they're not even there. They don't exist. So they can't tell you what's going to happen long term. In fact, the manufacturer itself admits full outcome data won't be available for years. Meanwhile, patients are being told to stay on this indefinitely, keep injecting every week for life, because once they stop, the weight almost always comes back. And this is what happens when a drug is marketed as a lifestyle substitute instead of a medical tool. We've medicated a symptom, appetite, and ignored the disease, insulin resistance, nutrients imbalance, lifestyle dysfunction. And the longer that continues, the more we trade short term results for long term risks. Now we're going to kind of transition to muscle loss. And this is the problem with rapid weight loss. So, one of the most underreported side effects of this medication is something I see as a nurse all the time, and that is muscle loss. And it's not just about how you look, it's about how long you live, how strong your metabolism stays, how well your body can heal. Recent research published in the Lancet of Diabetes and Endocrinology found that people using GLP-1 receptor agonists like Ozempic lose several times more muscle mass per year. And that's what's considered normal aging. That means your strength, mobility, metabolic rate all decline faster, even as the scales show you're losing weight. Problem is, it's not just fat you're losing the very tissue that burns fat, stabilizes blood sugar, and protects your body from falls, frailty, and early mortality. And that's what leads to the term many people have heard, like the Ozempic face. Everybody's heard that, the Ozempic face. So that's when the muscle and the fat melt away too quickly and the face hollows out. Skin sags and energy plummets. I've seen the same thing. Most people with like gastric bypass, they look very similar. So in the hospital, I've heard this, I don't know how many times. The nurses, especially women, they share some of the same complaints. It's usually hair loss, fatigue, and ongoing GI discomfort. And then this is just after a few months on the drug. And a lot of them quit because who wants to be skinny and no hair? Or who wants to be skinny and just have an upset stomach all the time? And these are signs that the body is under stress, losing lean mass, and struggling to adapt. Your muscle mass is one of the strongest predictors of longevity. And when you lose it rapidly, your metabolism slows down. Now, that's why so many people regain all the fat back and even more once they stop taking it. Because with less muscle, the body simply doesn't burn or process food the same way anymore. So, weight loss is the goal. It has to happen in a way that protects your muscles through protein intake, strength training, stable blood sugar. Otherwise, you're not improving your health. You're just kind of reshaping the illness. Here's the truth. Drugs like Ozempic and Wegovy can lower your blood sugar and they can help people lose weight in the short term, but they do come with trade offs. And that's what every person needs to know. And they need to understand that there's a chance for delayed gastric emptying, nutrition loss, muscle wasting, vision and cancer risk, and unknown long term side effects. And these aren't just side notes, they're the foundation of informed choice. And I'm not here to tell you what to do. I'm here to make sure you know what's really happening inside your body so you can make that decision for yourself. Because you weren't designed to depend on lifelong injections to manage your metabolism. You were designed to heal. And that healing starts when you begin working with your body and not against it. So the good news is your metabolism is repairable when you focus on real food, protein first. You got to do the strength training, consistent sleep, and stable blood sugar. Your body knows what to do. It can heal itself. Those are the same habits I teach my clients every day. And that's the same ones that's helped me watch countless of people reverse their diabetes naturally. So if you're ready to understand how to do that safely, I put together a free guide called the 6 Steps to Reversing Diabetes Naturally. And it walks you how to lower your blood sugar, protect your metabolism, and rebuild your health from the inside out, all without relying on injections, dangerous quick fixes, and it's free. It's easy to download, and you can grab it in the link down below. So, if this video has helped you, please share with somebody who's considering one of these medications because they got to know the full story, not just the marketing version. So, what do you guys think? Is Ozempic a good thing? Is it safe? Do you think you have to be on it forever? I want to know what you think. So, let me know in the comments below, and then I'll see you on the next one, okay?